Hi everybody, I'm Dr. Arti Gupta. I'm a consultant gynecologist at Mayom Hospital Gurgaon. Today I'm just going to talk briefly about the screening test for Down syndrome or abnormal babies during pregnancy. When you conceive, there are a lot of concerns which comes in your mind whether my baby is going to be healthy physically and mentally or not. So to overcome this kind of a thing, we have plenty of things. First, to rule out the physical abnormalities, we go for ultrasound screening and ultrasound test routinely. Then for mental illness or maybe mental retardation or abnormal babies, we have certain screening tests for that. So predominantly the screening test is done to rule out a certain chromosomal abnormalities, which is trisomy 13, trisomy 21, trisomy 18. So chromosomal abnormality is something I'll just tell you what it is in fact. When a human being is born, he or she is born with a 23 pair of a chromosome. So generally the chromosomes are found in pair. So when I say about trisomy, so one of these pair of chromosome has 3 chromosomes. That is where it leads to abnormal babies, which is predominantly having a mental retardation or there is a major physical and neurological deficit in the baby. So your concerns are dealt with the screening test. The screening test which is most popular during pregnancy is called double marker test combined with level 1 scan, which is an ultrasound. So in double marker, the mother's blood is taken and then there are certain hormones which is measured and then puts under a statistical analysis combined with the ultrasound report. In ultrasound report, which is done between 11 to 13 week of pregnancy to be precise, because the timing is very important here for the blood test and for ultrasound also. So in ultrasound, 3-4 features are being seen in the baby to rule out the Down syndrome baby, which is the nuchal translucency, which is like a soft part at the nape of the neck of the baby, then presence or absence of nasal bone, then there is a vessel in a heart which is called ductus venosus. So phenologists see for the blood flow in that also. So if all these parameters are fine along with your blood tests, these tests are subjected for a statistical analysis, which is just as a screening test, which just gives an idea whether you fall in a high risk category or a low risk category. The screening test will not tell us, it's not a 100% positive or a negative test. So it is just going to tell us that whether the patient falls in a high risk category. If the patient falls in a high risk category, there are further tests which is advisable, which can be invasive and non-invasive. What I mean to say by invasive test is that in case if it is a very high risk screening test along with some finding in ultrasound and we need to confirm whether baby has some chromosomal anomalies, so we go for an invasive test which is CVS or amniocentesis, where we put a needle, either collect the fluid of the baby in which the baby is there or collect the blood and then test for the genetic abnormality. Now the recent thing is, which is a non-invasive test, which is also called NIFT commonly, where we take the mother's blood and look for the presence of baby cell in that and then detect the genetic abnormalities in that blood sample. Suppose the double marker is normal and the ultrasound is normal, and if you are on a high risk category, let's say if you are more than 35 years of age or you have a previous history of a Down syndrome baby or any other risk factor is there, then your doctor may suggest to go for a quadruple marker, which is done between 16 to 18 weeks of pregnancy combined with the level 2 scan. So this is how we screen and tell you and assure you that yes, your baby is going to be fine. Thank you so much.